Mo, can you believe today's show? Here we are.
Well, all I can say is the doctor is in. Happy Woosah Wellness Wednesday with all of you. I'm just so excited to see everybody and so thankful for this amazing energy. This is what I needed in my day, Ricky. I really did.
Well, it is here, and we had to start record like 10 minutes ago because I didn't want to miss what these badass women are saying. So, it was the 4th of July. So what does that really mean? Right?
Mm-hmm.
Celebrating Independence Day, waving the flags, doing the fireworks. But, we're not free from disease. We're not free in health disparities. And so, COVID put all this on the table, and even gave us a seat, right?
Mm-hmm. Mm-hmm.
We're all now sitting at this table where everybody's talking, and more talking. But what are we actually doing? And what do we want people to do? What do we need to do? But we got to stop this craziness, right?
You're right. I hear a lot of talk. You're absolutely right in that we just have this new campaign, more than just words, because we hear it a lot of words. And right now, more than ever before in the public eye, Black lives seem to matter. The lives of Black women, the accomplishments of Black women, the successes, the failures, all of the things right about us are in the forefront and in the limelight. And I think it's such a great time to talk about the things that need to be in the forefront and the limelight, like our health, like breast cancer, like disparities, like what does it all mean and what should we be doing about it, moving from the talk to the action, because that's what it's about. So here we are.
Here we are. Here we are. Let's do it. And I think that, why does it have to be that millions of people have to die to get us here? But you know what? Let's take advantage of the situation and, GSD, right? So today, oh my gosh, we have these amazing, amazing women on our show. And we were just talking about how, God places these people in our lives for a reason, and you may not know at the time, but when you know, and it's supposed to all come together. So we have these like badasses, that we have.
Well, let's introduce them. Let's let them talk and let's get into it.
So Sheila has been a consultant to pharma companies for a lot of years, bringing value when they need, when they need that Black voice in the room and the voice of wisdom in the room, they bring her in. And she has now commanded this presence with a lot of pharma companies that's just, she's really invaluable to them in terms of making marketing decisions, product decisions, really. And I'm gonna let you talk, girl, but she's just like, a force. And then Z and I actually work on this advisory board together, and she is like in the trenches. And the first time I talked to her about breast cancer, she's like, a navigator in Oakland, in where our people are doing the good work. So, Ricky, sometimes I can't even get to the breast cancer conversation because I'm trying to find them a place to live. I'm trying to get them dinner. I'm trying to make sure that they are going to make it home today. So she is seeing all the stuff every day. So I think we have the boardroom and what should we call it, Z? The real world.
The real world. The real world.
Right. So Sheila, talk a little bit. Tell us what you do.
Well, first of all, thank you for having me. And clearly, this is an opportunity that I think we all have hoped for as we come out of this horrific pandemic and hopefully begin to see and prioritize things that really need to happen long overdue. I've been doing multicultural healthcare marketing for Big Pharma for 27 years. But I tell my clients, I've been Black a little bit longer than that. So I totally understand exactly what needs to be said, how it needs to be said, who needs to say it, and when. And once you get that in your wheelhouse, it's easy to have a conversation with people about their health. And so part of what I do for Big Pharma is to not only raise their awareness about people of color, what it's like for me to live in my skin as a Black woman, but how now do you take those insights and make them a part of the treatment regimen and outreach program and the way that providers should be taught about how to talk to me and what I want to know and how I want to know it. So it's been a journey. It's certainly been a journey. And it was out of my naivete, Ricky and Dr. Mo and Z. I just sat in those boardrooms of Big Pharma and they were talking about type 2 diabetes and hypertension and cancer. And when I looked at their marketing strategy, they weren't talking to the people that had the disease. And I said, why are you not talking to these groups who are disproportionately impacted? I'm talking about the early 2000s, late 90s. And they would kind of look at me over their glasses. Oh, those people are sick because they're poor and they can't read, they can't write. I said, hold up. Some of them are, and we need to talk about how to help them, but there's a whole lot of folk you're missing. And didn't your website say that you're here to increase the quality and longevity of life of all Americans? I think you missed me, okay? So I started challenging them about what they were doing and how it needed to be disrupted and switched to a different paradigm. It was highly resistant. People were reluctant, and I got major pushback, but I kept hitting it because I knew it was right. And I knew there was a way to help get them to where they needed to be. So that was the start of my journey. So I've worked in HIV, cardiovascular disease, and certainly in cancer. And all of us have been touched by cancer in one way or another, either personally, family, or friends. And my dad died of pancreatic cancer at the age of 47. My mom was a nurse, and she went back to school and raised 4 kids in New York City and did not go on public assistance. So that's the stock I come from, blessed and happy that experience as a child, 12 years old, losing my dad, was a major impact in my life and really put me where I am today. So I'm happy to be at the table. I don't want to be the one by the door. I want to be in the room, at the table, up front, not an afterthought, not an appendage. Put me into the mix from molecule to market. And then maybe I'll hear and listen to what you have to say.
I love it.
I love this. Today, 7/7, is my grandmother's birthday. And my grandmother passed away in 2014. She raised me since I was 7 years old because my mother died of ovarian cancer when she was 29. And this woman raised 8 children and then raised 3 grandchildren, put herself through school and became an EMT and became a nurse. And she was one of the first Black EMTs in the city of Philadelphia, and then went on to nursing school. And when I look back at the stock that I come from, when you say that, that resonates with me, because this woman was diagnosed with cancer. And each time some doctor told her, some lousy numbnuts doctor told her, well, you got maybe 6 months left to live. Why don't you start making your plans and start, thinking about, what comes next for you? And she said, I got 2 grandchildren, 3 grandchildren I have to raise. And one of them's going to be a doctor. And she said, so I don't have time for cancer. And she went through her treatment, surgery, radiation, all the things. And then guess what? She lived another 15 years and got diagnosed with breast cancer again in the other breast. And some jackass told her, well, you got 6 months left to live, so start making your plans. And she said, I'm not finished yet. Okay. And she lived another 20 years after that.
God bless her.
And it's something, the way that we treat these patients and the impact that that your testimony, your story has on the people who are watching and the lives that are being changed. And what I love about, and what I want to ask you about is, why do you think pharma, and why do you think these companies are afraid to market and to talk to Black women? Like, why don't they start there? Why do they start somewhere else?
It's a great question, Dr. Mo, and I have a couple of answers to it very quickly. Number one, there aren't too many people in those decision-making positions that look like us. And unfortunately, they come with all of the biases and prejudices that people who are not of color have, the stereotypes that they have. So when I step in the room, I'm usually the only chocolate chip in that cookie, okay? And when I start talking to them about my life, what it's like to live in my skin, they're totally unaware of the impact of social determinants, of where I live, what I eat, how I feel, am I safe, how that impacts health. So there's a level of cultural incompetence, a level of what I call ethnic ignorance that is pervasive and persistent in the industry. So that's number one. Number two, Big Pharma is not set up to do multicultural outreach effectively. It's siloed, okay? You've got the marketing team, you've got professional affairs, you've got global clinical research, and they don't talk to each other.
Right.
To be effective in multicultural marketing, it's cross-functional. Everybody's got to be in the room because everybody's got a stake in this. So you're talking about a structural change that has to occur so that it's on the table before you even put that protocol in place. Okay. And if it's not there, when you get FDA approval, it's too late because you really don't know how that drug or that regimen works in me. You're guessing.
Right.
And I don't know about you. I don't want to be a lab rat or a guinea pig. Okay. You need to know, because that's dangerous not to have that scientific information. So pharmaceutical companies never thought about the patient. It was always about the physician who writes the prescription. Okay. When managed care kicked in the late 90s, then direct to consumer kicked in. You started seeing commercials on TV and all of, then they said, okay, the managed care said, no, no, it's the patient. Okay. So that was a total shift in their mindset. And they were slow about making the change. And they felt that one size fits all. Never did. It certainly doesn't. And now with the demographics, it's scaring them. They're scared to death of these numbers of Black and Latino and Asian people. But you think all this conversation about the border is happening now, okay? Those white middle-aged men and the white so-called majority population have no understanding of what this impact is going to have, and they're frightened, and rather than embrace, they resist. And unfortunately, it's our job to say, turn around now. You got to do things differently. And that clearly is the dynamic that's happening because of COVID-19. It's putting it in their face. They can't ignore it anymore. So nobody in pharma asks me why they need to do this. They now ask me how. How much does it cost? When is it going to happen? When am I going to get the return on my investment? That's a great place to be.
Right.
Because there are enough of us out here who know what works. We're not being in the academic situation, but we know. Put us at the table, we'll tell you. And then we're going to challenge you. Mm-hmm.
Well, Z, let me ask you, in the real world, in real life, where, people are dealing with trying to figure out if they can afford their chemo or afford their mortgage, right, or their rent, how is the message translating? Do Black women feel more at the table, more cared about, more concerned? What are some of the things that we need to bring to the forefront in this conversation from the patient perspective?
Well, from the patient's perspective, and again, I'm a breast cancer navigator, and the way I process information is really an offshoot of the way my patients experience it. I try to center humanity, because if I center race, then I'm already diminished, because that's a fake construct. Mm-hmm. So I'm coming, no, we human, and you're going to treat everybody like they're human. I don't care what color you are. I'm going to love and care for my patients the same, and I hold you to that same expectation. Because if not, then we're going to have a different conversation if it's about race. So getting that out the way, where I'm at, I'm so blessed, because we're not only at the table, we're building our tables. Mm-hmm. Because there's a difference between an invitation and an extraction. Mm-hmm. If you've already made all the decisions, you've already figured out how you're trying to operationalize it, and you're doing all this and you're doing all of that, and then you call me in, well, that's not an invitation. Mm-mm. That's like calling me, inviting me to dinner after everybody's been served. Mm-hmm. And because I get a piece of the dessert, I'm included. No, I don't think so. If that was a 5-course meal and you said this invitation was for dinner, why did I only get served dessert?
Mm-hmm. You preaching.
So
I'm telling you, amen.
So, that's always my perspective, because I feel like this. In order for me to do my job successfully, I have to be as aggressive as the cancer, and I have to be as persistent as the poverty. Mm. I'm not in a position where I can really address fully what's happening if I don't do that. Mm-hmm. And I'm blessed because I'm in Oakland, California, mm-hmm. and there are some incredible women that are leading the charge. I have in the chat box where a COVID effort, and it's not even an effort, it's a class, okay, that was headed by Dr. Kim Rose from UCSF. That her COVID, the way she designed it and just empowered it, and I don't know, she didn't engage community, she embraced community. It wound up in the New England Journal of Medicine, and it's not even a year old. And so that's what I mean when I say we aren't just seated at the table, we're building our tables. Mm-hmm. And that table was successful because the lived experience isn't just centered. The lived experience is actually helming. Mm-hmm. And I feel like that's always kind of lost. Like, oh, we want to center the lived experience. Well, guess what? If you center the lived experience and you don't have anyone in positions that are surrounding that center, then you're just lost in the middle.
Mhm.
If everybody is making decisions that aren't familiar with the community, that aren't from the community, have no understanding of what it's like to be poor, let alone Black, then you get lost in the middle. You're not centered, you're lost.
Mhm.
So it's very important that you have a system that is well-rounded, and that's all about the continuum. And that's what that project was able to do. We weren't just centered, we were allowed to helm. We were positioned to be empowered
Mhm.
through enlightenment and through embracing the actual community. And that's what I mean when I say that. And then we have Director Kimmy Watkins Tart, that is the director of our public health department. And they were
Mhm.
able to partner and work together and really help with the COVID. And when I saw that, I thought, you know what if we could do that with cancer?
Mhm. Yeah.
Mm. Hey, you
Mhm.
guys, let me read you
The
this quote
social
I just
determinants
found.
were the same.
Okay, go ahead. I'm sorry.
I'm
Um,
saying the social determinants were the same. The
Right.
COVID patient and the cancer patient in Oakland look just alike.
Mhm.
yeah.
Mhm.
But the leadership approaches were different.
Yeah.
That outcome, it just blew me away.
Wow. Let me read you this quote I just found on Twitter earlier, a little while ago. And
Okay.
it's from Dr. Sanya Springfield,
Mhm.
and she's at Health Disparities at NCI,
Okay.
Director of Center to Reduce Cancer. Quote, cancer inequalities reflect the underlying structural racism
Mhm.
and systemic inequities that continue to prevail in our science and in our society.
She's spot on. She's spot on. And,
Right?
Z lives this with patients every day. I see it when I work with pharmaceutical companies who may have a champion who gets this from inside and tries to drive it. But unless there's commitment from the top down, that person who is a lone wolf trying to cry out for the underserved and the marginalized gets lost. So that's the other challenge. It's got to be a top down, sustainable effort so that those inequities can be addressed head on. You can't ignore them, they're there. And Z hit on something very important too, in the fact that you've got to treat the whole person. Yes, there are large numbers of us who are poor, and certainly we need to give them special care. But there's a lot of diversity within diversity. I know Black middle class women who have insurance that are still dying from cancer.
Tell me about it every day.
Late diagnosis. You see what I'm saying? So we're not monolithic as a people. We're diverse. But that thread of mistrust, distrust is pervasive. It runs through all population segments with regards to economics and what have you. So Black middle-aged women, Black women who are very privileged, they still have the same thing. It's an equal opportunity disease, okay? It doesn't discriminate if you're rich, that you don't get it. Everybody is susceptible to it. And that's the problem that pharma has. They try to box us into a bucket. You can't do that. We're more diverse internally than we are between groups.
But pharma is also greedy.
Their business model, Z, is very different. They purport to be about health, but sometimes what they do belies that claim. Okay.
Yeah.
So they've got to get back to basics. And you can make money and serve society. The two are not mutually exclusive. Okay.
I would agree with that. Absolutely.
My patients, many of them are in the safety net, so they receive Medicare. And the hoops that they have to jump through to get a prescription, if they're not fully covered, that donut hole, that it is the size of Grand Canyon. And then you look and then you see where now, some pharmaceutical companies, they want to pull a certain drug from out of the formulary, and you do all these things, and it's just it's awful. And I feel like in those spaces, that's where you have to bring intentionality. And there are moments when you can inquire, but there are times when you have to interrogate. And when I say that, I mean, that's when you have to test the commitment, or as my sister would say, you have to test the spirits.
Okay. There you go.
And what you embody, if those two don't meet, okay, somewhere we got a problem.
Yeah, I've worked on 14 clinical trials and where the company has wanted to increase diversity. And there were some that were race specific in terms of Blacks and Latinos in particular. And when you look at the protocol, you look at that document that they start out with from a scientific perspective, All I have to do, Dr. Mo, is read that inclusion exclusion criteria. And I say, oh, this is going to be a long haul.
Mhm.
You're not going to find these
Well,
folks.
exactly right.
Yeah.
And that's the thing, you know, that's where I feel like there's a whole lot of lip service going on, because
Yes.
when it's not designed with us in mind at the front end, they end up trying to do a lot of things to make it fit. You know, it's like trying to make the shoe fit after you've already invented it, when it doesn't
Precisely.
quite. This is a custom made shoe, right?
That's
This
right.
should be something that's designed with these patients in mind. And
Right.
then they hand it down and they wonder why there isn't greater uptake, why there isn't higher enrollment.
Exactly.
Well, we've given a voucher for this. We've made an accommodation for
Uh-huh.
that. We've done a such and such for this, when, you know, it really needs to be baked into the cake. And
Yes.
that is why there continues to be poor clinical trial participation, you know, and exactly right, Sheila, what you brought up was the same thing that COVID brought up, which
Oh,
is
yeah.
that these ideal patients, like, we don't live in a bubble. There is no ideal cancer patient, you know,
No.
there's no model patient. And if there is, then these drugs probably shouldn't be used and tested on them. It
That's
needs
right.
to be tested in the real world and generate real world
Exactly.
evidence and
Exactly.
real world
So
data on people that actually need these drugs.
exactly. Those IRBs, those institutional review boards,
Yep.
you know, the global clinical research teams that are scientifically focused, but not humanly focused.
Thank you.
Okay.
Mhm.
And does this protocol need to be so restrictive? You know,
Yep.
will it lessen the scientific integrity and the outcomes? Those are questions that we have to challenge. You know, and do
But
you
have
really
that
need to
need.
have people treatment naive that's not on any drug? You know, any Black person that's not on any drug. Okay.
Right.
I mean, so
And I get
High
the
blood
need,
pressure.
right. I get the need to limit confounders. I'm chair of the
Sure.
IRB at my institution, right? And you
Yeah.
want to limit the variables so you can see what's really causing what, especially when we talk about
Absolutely.
side effects. But
absolutely.
there is no ideal patient, and we need to be able to, in 2021 year of our Lord, we need to be able to account for the effects of high blood pressure and diabetes on a cancer drug. We really
Exactly. Exactly. Exactly.
And you guys, so why was COVID different? Like, why? What happened? What happened this year that like opened their eyes a little bit? Like, what happened? What's different about it? And why can't we apply this to cancer?
Mm.
Well, COVID, from my perspective, it came with an economic hit that was immediate and that was sustained.
Wow.
Mhm.
There you
Mhm.
go.
Talk
There you
about
go.
that some more.
Bottom line.
There you
Mhm.
go. There you
Tell
go.
us more, thing.
COVID was transmissible. You could catch COVID.
Mhm.
So that was the fear. Because, oh my God, if all these people catch COVID, then there goes our economy. You had people that were small business owners, you had restaurateurs, you had all these different people, and they were susceptible to poverty.
Mm,
Mhm.
Okay, that's the way I look at it.
Mm.
Mhm.
Susceptible to poverty,
mm,
Mhm.
because there's
That's
so
right,
much
girl.
that is stereotypical in
Mhm.
our assessments of patients and their deservedness. And that's
Mhm.
applied through our marketness, how they're marketed. If
Mhm.
you're poor and you came poor, honey, they feel you're gonna be poor when you leave. So
Mhm.
really, how much of a difference are we gonna make in your poor life?
Mhm.
COVID, well, a lot of these were well-to-do and educated, and they were entrepreneurial, and they were all that. So, oh my God, the loss, it's magnified.
Mhm.
You know, and then I hate, you know, to appear cynical, but this is what I perceive
Mhm.
based on the experiences of my patients for the last 8, almost 9 years.
Yep.
They don't come with an economic advantage, or they don't come as economic contributors and drivers of the economy,
Mhm.
as opposed to so many of the COVID patients. And I think that's the largest driver. That's why I challenge it now, because my cancer patient is just as important as the COVID patient. So now
Absolutely.
I see how much y'all care about everybody.
Mhm.
I want some of that money.
Mhm.
That
Keep that
funding.
same
Where's
energy.
that?
There
Yep.
you
Keep
go.
that
Where's that
same
for cancer
energy.
patients?
Mhm.
Are we going to
Mhm.
get one? See, that's what I mean when I say we can inquire, but there are moments when you have to interrogate. This
Mhm.
to me is more than about just talking about the disease. I want to talk about the funding, because
Mhm.
clearly there's a funding mechanism that has to be considered, because y'all consider all that when you started throwing all that money at COVID. So what I'm saying is, in the interest of equity, let's start throwing some of that money towards cancer patients, because they matter just as much. So,
Interesting.
That speaks to accountability too.
Yeah.
I mean, once they do get in this pot, we've got to hold their feet to the fire.
mhm.
If you could write a check for that quickly because of COVID-19,
Right.
why can't you do the same thing for cancer? Why can't you do the same thing for those rare cancers and for
Mhm.
all the other therapeutic categories? So the money is not the issue, it's the disbursement and who's in charge of that disbursement and what the return on investment is. I had one company say to me, well, if we do this program like you're suggesting we do, what's the return on investment? I said, well, what's the return on investment with the white campaigns you do? And he said, well, that's a good question. We don't have one. I said, then why are you asking me for a return on investment? I can't even pronounce your drug or the name of your company. And now I'm supposed to buy it in 90 days because you're coming to me because you see a revenue opportunity? Come on now. Don't hold my feet to the fire. I have to hold yours to the fire to
I
do it
think
right.
a couple of things, you know, and Z, you bring up some great, Sheila, you too bring up some really great points. I think one of the things about COVID was when you talk about the economics, right? You're talking about the service industry, right?
Yes.
So truckers, right? Produce, meat markets,
Right.
buses, transit, housekeeping, every service industry, hairdressers, everything, supermarkets, stocking the shelves, everything was affected by COVID. And so you saw you saw the loss immediately. You saw the economic impact immediately. There was disparity in how vaccines were given, in what drugs were available, even in what drugs were recommended, right? Because at one point they were giving hydroxychloroquine, which was experimental and not approved by the FDA, to prisoners, to people in nursing homes, right? So you can see that we began to do these things. There was some disparity and some inequity in the treatment, but I wonder if the statistics that we need to highlight regarding the significance of the impact, the financial impact of cancer on households, on the bottom line economy of the country, on a lot of different, maybe we need to be looking at these statistics differently such that the impact can be seen and can be felt. Right?
Absolutely.
Because there's a lot of women, there's a lot of breadwinners, there's a lot of men, there's a lot of folks who have cancer, and the impact of that cancer, their years of working, the wages that they might make, the social security, the financial toxicity of all of it, and the downstream effect of all that on their entire generations, right? Because that's how cancer works. It doesn't just rob you. It robs your children, it robs your children's children, it robs your entire lineage of the opportunities, right? And so maybe we need to be looking at this data a little bit differently.
Exactly. And the data that drives the dollars in the industry. Okay, you got to have the numbers. And I remember talking to some public health friends of mine in late 2019, and they were talking about this novel coronavirus. Okay, it hadn't yet come on the global scene, and I heard them. And this was November of 2019, and they said it's coming, and it's going to hit us the worst. January comes, and the numbers started coming out. And I kept asking, where's the ethnic data? How is this hurting people of color? Nobody was talking about that. It wasn't until the World Health Organization declared it a pandemic in March that the data starts streaming out. And they say, oh my God, okay, what is going on here? We're dying 3-4 times of the folks, and nobody is paying attention to them. They put us in a bucket, marginalized, assuming that we were sick because, oh, you don't eat right, okay? You don't go to the doctor, you don't take your medicine. Instead of not the symptoms, they weren't looking at the cause of that behavior.
And you know what, Sheila, for a minute, it was a Black disease.
That's right.
That's right. And then more white people started dying, but for a minute, there's that probably like 1 or 2 weeks where, oh, well, only the Black people are gonna get it, so it's okay.
Exactly.
Right?
Right.
Started to get bigger and bigger and bigger.
That's right. Right. So we don't have to lock down. They're the only ones dying. So
Right.
You know?
Don't go to the Black stores, right?
But going back to the data, what I would like to see as a way to dispel stereotypes is what the impact is on local economies. So many of my patients, they do work. Okay. Sometimes they're the head of the household.
Right.
They have those jobs where they can't really get off work, or when they do get off work, that is a major hit to them and to the economy. So it would be interesting to say, you know what, COVID, this was the damage that was done to the economy by people's inability to work. This is the damage that's being done when a cancer patient is no longer able to work. This is how the local economy.
You're absolutely right.
These are the losses. And really
start
building that up, you know, if that's what it's going to be.
It's
the cause. You know, when you got too many bad apples on the ground, you better start looking at the tree and the soil. Okay, so you got to figure out, where's this coming from? Why is this? More educated, have more money than we've ever had, more politically conscious than we ever were. Still, those statistics haven't changed. They stuck, and they're even going down. And to your point, Dr. Mo, I mean, all of those service people, they're the ones that are keeping us alive.
Yep.
Right.
Those EMTs and those hospitality people,
Exactly.
the truckers, all of those people, they couldn't stay at home. They couldn't lock down. Okay.
Exactly.
So they were exposed just environmentally.
Yep.
They had no choice. And that would damage not only them, but their families. You're going to take that home? I mean,
How about that bus driver that died, right? The black bus driver that died.
Yes, so many examples like
the
that.
doctor, the black doctor that died. So many.
Yeah.
So many. I mean, I remember when this was coming down the pipe, we heard from Asia, from Italy, from lots of different places. Hey, are you seeing this? Is this what are you guys seeing this over in the US? And everybody said, no, we hadn't seen it yet. And all of a sudden, boom, it hit. And then it hit San Francisco and it hit New York. And it was like, well, what is happening over here? It hit Seattle, right? And I had a friend who was in Texas and in Georgia, in rural Georgia, sleeping in his garage, fire ants biting him up, right? Because he doesn't want to take this in to his family. And so the stories are very real, but the resources that were mobilized were equally real. And so I think that the challenge does become, how can we bring pressure to bear on the Biden administration, who has stated an explicit desire to focus on cancer, just like the war on drugs back in the 80s, right? There's a whole war on cancer. There's a moonshot. There's all this stuff coming. And, where it starts, of course, is trickle-down economics. It starts in the hallowed halls of academia, where, they can get the research dollars and the funding and mobilize things, but 80% of cancer care is done in the community hospitals.
That's exactly right.
It's in your neighborhood. That's where you're getting it. And so these people we're still waiting for it to trickle down into our communities. And how can we begin to impact that is a question I have for all of you.
Well, Z is in community every day, so I defer to her and I'll put in my 2 cents.
Well, the thing is, it's a nuanced response to that. Actually, I believe it's asymmetric. I don't even believe it's direct. I believe you have to tackle it on all fronts. A lot of it, from my perspective, is that sometimes you have broken people that are stuck in a broken system. So where do they have the luxury? Because sometimes I don't think we understand that we have a responsibility, but we also have a luxury to fight. Everybody can't take on nothing else.
Right.
Life is so full, it's so complicated.
Yeah.
So you try to find areas in which you can carry that voice and that concern and that priority.
Yes.
Because having someone acknowledge something does not mean it's prioritized.
Right. It's true. It's true.
So who do we know in our circles, and not just professional, but even all the listeners and watchers today, viewers today? If you got time to watch this, you may have time to tune into a Zoom meeting with your public health commission, or you may want to talk to somebody, that's part of your hospital authority. There are things that you can do. You don't have to become a pledge your life, but you can maybe sacrifice a bit of it to help save someone else's. I got into this by happenstance, advocating for my patients, because I was just like at my wit's end. I couldn't find help. So I just kept going to different offices and bringing the issues before them. And before I knew what happened, I was directed by a board of supervisor. You know what, you should maybe look into the Public Health Commission. Didn't have to provide me with necessarily access. I didn't get appointed right away. I wasn't even seeking an appointment. I didn't even know where to go, but I was guided.
There you go.
I was helped. So even if you can do something like that, to help guide the process.
Right.
You can
the key to
influence the outcome.
To me, the key to success in going into communities of color is partnership. You got to find a Ricky Farley. You've got to find a touch, because I live in New York. She lives in a certain city. But in order to really make that partnership work, you got to find the groups and the organizations and the gatekeepers and the brokers to that community and walk in the room with them. Not that paternalistic, we're going to help the poor Negroes, okay? You got to walk in the room with me so that she has the tentacles. They trust her because she looks like them, she talks like them. Now that company has to give her enough resources to do that well, to do that more and better, because she doesn't need to be validated. She's already successful. So in every community I go in, I look for those community partners. And it's not always the healthcare people. It's
No,
just
it's not.
who's the most prominent community activist.
Right.
Who does the community go to when they're in trouble? And that person is the voice. You put that voice on the commercial. You put that face on the poster and
Come
that
on.
face on the flyer, okay? I don't need a star. Celebrities are fine. You can get the media if they're there, but after they're gone, you need
Mhm.
folks on the ground in the
But-
community that I can go to in church, in the beauty salon, in the barbershop, and say, were you at that meeting? Did you hear what they were saying? That's
Mhm.
where the groundswell from the bottom up helps you to really connect with community because it's about them.
I
And
love
have have communities understand what a real partnership looks like. Because
Exactly.
oftentimes
that. Say more.
it's not a real partnership in the way in which we need it. A real partnership starts out, it contains an embrace,
Mhm.
not just this little invitation to work together. It's not transactional.
No,
It's
no.
based on
Woo-wee.
commitment.
Yeah, that's right.
You know,
And it helps to put some money on the table
it
too.
helps.
One client said to me, why can't they do this for the good of their people? I said, oh, really? Why don't you just give your drugs away for the good of the people? Okay. You know, that's not going to happen. So put the
Right.
money commensurate with the need. Okay. No chump change, no crumbs. Give me something real that I can make a difference with. And don't, just buy me off.
Commensurate with the population,
Exactly.
commensurate with the people impacted. And
Exactly.
I have to say that there are some amazing pharma companies who have
Absolutely.
stepped up and come out and supported us. and said,
Absolutely.
okay, what should we do? Help us plan this. Help us
Yes.
navigate this. And so I appreciate them. And they're
Yes.
sponsoring our show, Genentech and Amgen, and
So many.
so many of them get it. But there's still a lot that are in the dark.
Right.
And when I say they're in the dark too, especially when you start talking about clinical trials and stuff,
Yeah.
same thing over and over again.
And over again.
Treadmill in the
Yeah.
mouse cage, getting the same bad result. And I
Yep.
don't know what's going to make them get it. And they wonder why. It's almost like, when do you engage? You got to engage us from the get-go. You got to engage
Beginning.
us when you're planning. You got to engage us to talk about it.
Yep.
Mhm.
Yep. You know what I think, Ricky, too? I think part of it is that we end up getting into these watered down conversations, just like, recently, of what is measurable, right?
Right.
What is going to be a short-term gain and a return on investment? Because
Mhm.
many of these challenges, like you can't fix cancer in a single campaign,
That's
right?
right.
You're not
That's
going
right.
to increase, clinical trial enrollment through a series of texts and commercials in a single campaign, but what can we do that's measurable, and then what are the
Absolutely.
long-term goals? And so to me, it speaks to the need, I think, for further collaboration among
Exactly.
companies in something of almost a repository or a registry of sorts,
Yeah.
so that we can begin to build on the data that we're collecting and move it forward. I'll give you an example. If we want to look at campaigns that increase the screening, 3D screening mammograms in Black women, well, how are you going to track it? How are you going to report it? How are you going to know if the campaigns are working? And if everybody would contribute these things, right? If there were a way to centralize and notice without somebody having to go on and log into such and such and say, okay, yes, I got my mammogram, because that's an extra that people might not take. But is there a way to quantify the effects of some of these campaigns through a more collaborative system? And I think that that's something that our organizations really can work on, because we end up in the same spaces at the same tables doing the same, work to help further these causes, but maybe we need to be the sources of the data.
And that's, I learned early on with Big Pharma that I couldn't take them out of their MO, their modus operandi. What I had to do was, how do I infuse my strategy in with what they already know? So I learned how to adapt my conversation. And one of the things I do is I do zip code community mapping, okay? The pharmaceutical reps call on zip codes. The payers pay by zip code. Right. So if that's your model, let's do that. Okay, where's the zip code that has the highest percentage of African-American women? Okay, focus there. Let's quantify it. And it's qualitative and quantitative. You've got to get the qualitative first before you start counting numbers. And that's a process. I remember talking to one company, well, how do we engage these groups? They're hard to work with. They're not corporations. Well, no, they're community-based. So I walked her through the process of how to connect with community groups. And when I finished, she took notes. She said, well, that's labor intensive. I said, yeah.
Hello.
So how do you start a relationship? conversation, communication. You know, when I work in the Black church, I go 3 weeks ahead and I do church. Okay. I don't come in there and start telling them what they need and what they need to do. I become a fixture. I become part. I create a trusted presence in the community.
A relationship. A relationship.
It's all about relationships. How do you make a friend? You talk to them. You listen.
Well,
Okay.
You're so funny
Well, in
because
their mind, they are establishing a relationship, but it's transactional, and that's
Yeah.
the problem.
that's the problem.
That's why it's very important from a community perspective that our lived experience just not be centered, but our lived experience be allowed to helm, encouraged to helm, because you set the tone for that relationship. I don't need somebody sitting next to me to tell me how this gentleman should court me. I determine if I like that.
Okay.
If okay, I appreciate it, but no, because this is my relationship.
Right.
So
Right.
I should be the one to determine, was the courting successful? Is this something I wish to continue with?
Yeah. What are the terms of engagement? What are the terms of
What is going on?
There you go.
And
There you go.
we're not there. We have these intermediaries saying, well,
Come on.
no,
Yeah.
it ain't for you to think.
Mhm.
It's for us to think, because this is a relationship that will directly impact my life. If
I
I
got
get
it.
a long-term relationship and they wind up, not being cool, I need to be able to do what I need to do. Get
Right.
rid of it. I
Yeah.
don't want to have to talk and meet and this and that to say, no, they're abusive. This is not working.
It's like
Right.
speed dating, not getting married, right?
Right.
I actually told one of our pharma partners this week is, our breasty love, I talk about our breasty love all the time. There's nothing like it, but we are together all the time and we talk about whatever. I said, y'all need a support group.
Yeah.
You all come into one room and be a support group because they're all trying to solve the same problem.
Yeah.
But they're so competitive.
Very
And
competitive.
different disease states. They're not all making drugs for the same diseases. So find a partner.
Correct. Correct.
Not be in
Yeah.
your competitive space,
Yeah.
but they're still dealing with the same issues and support each other and figure out how to solve these problems and embrace us so that we
Yes.
can do that. But they need to stop being silos about how they even talk about this stuff and maybe invest a little money in talking to each other as opposed to trying to keep it quiet, keep their secrets. And it's
Exactly.
So Ricky, maybe instead of them bringing us together in round tables and having us at the table, maybe we build the table and bring them together in a round table.
Now you're talking.
You know what I mean?
Now you're talking. Mhm.
Right. And so it becomes you send a rep and you send not you come from your demographic and you come from your patient perspective and you come from your patient perspective, but maybe, flip that script a little bit. I think the other thing is some accountability, because when these campaigns are not sustainable, when diversity is no longer a buzzword, when health equity isn't on the menu and isn't the soup du jour, what happens to the funding, to the programs, to the support, and to the community organizations, that have been around for 30 years with the church band taking people to radiation, right? That have been around trying to scramble and get wigs and trying to do their own look good, feel betters, and have been trying to help people pay their bills. And, what happens to those organizations when this is no longer popular, because everybody's on the bandwagon right now because there's funding and because health equity is the buzzword.
Exactly.
So how do we, and this is my question for you guys, how do we hold them to the fire in terms of accountability, sustainable accountability to the community? What does that look like?
And sustainable is the key word.
Maybe you start crafting community benefit agreements. So that there's a framework and the expectation has been set and agreed upon. It's almost like the equivalent of Beyonce saying, if you like it, put a ring on it. If you're gonna be, a part of this community as a partner, and we are developing a long-term relationship.
I love all these dating references, Z. I'm loving it.
I know
all these relationship references.
Look like.
I love it. I love it.
And that gives you a framework. It allows room to grow. From there, it's organic. You can start adding measurements and indicators. You can do things to say, you know what? We want this to be part of our workforce development. And we'd like this to be a project in which part of our empowerment and part of your agreed upon commitment is to start teaching members of our community clinical research, how to help in these same trials that you wish to engage in. So you start doing things like that and really kind of flesh it out. And then I believe it helps to address mistrust.
Yes,
It allows and it encourages a close collaboration,
right.
and it leaves room for growth. Because 9 times out of
Exactly.
10, if you come to me for one clinical trial, you'll be back.
That's
So why
right.
would you want to have to re-engage and start
Right.
anew
Mhm.
when you can keep this as a continuum?
I
That's
ask a
right.
lot of questions before a company asks me to do something. What do you think will happen if we do this program? You know, what are your expectations? Because I come in with one thing
Yeah.
in mind to help my people. They're coming in another mindset to increase market share, you know, to increase. So you got to have some kind of a meeting of the mind so that at least you both can be on the same page. And then the sustainability is there. You need at least 3 to 5 years of funding to make this work. It's not going to happen in 90 days. It's get out of that pilot market mentality.
Yeah.
Okay. This is an investment. This
Yeah.
is market development.
Right.
This is not
Yep.
going to move the needle because you
Love that.
granted us this little bit of money to do something for a year. You
Right.
got to shift the paradigm because I know how they measure success. That's not how we measure success. But there's some way that you can, those things can cross, they can intersect. So I try very hard to get in the mind of the company to make sure that where we align. Where are we closer together than further apart? You know, we're not going to be together in everything, but if we think about the patient personalized precision patient medicine, that's where we agree that that has to happen. You're going to make some money, I'm going to help some folk. So how do you get there is how you have to navigate that conversation and benchmarks of success along the way. You know, what's it worth to you to know a Z? What's it worth to you to work with Ricky? Do you value what they bring to the table, or is that simply an afterthought? You got to get that out on the table, because if you don't value them, you're not going to put any money in them. It's just going to be a check the box and go away, and I helped the 4 folk once.
Right. And we're starting to see that in some of our partners too, that
Yes,
that
we
they are in it for the long haul, and we so appreciate what they're trying to do. But they're, you know, they're on they're avant-garde, they're on the forefront of it, and you know, they're I can count them on one hand, but
Exactly.
they are looking forward. I think that, you know, it's like, you know, I worked in marketing for many years, and basically, so you're a brand manager on a brand for a year or two. So you do the marketing plan for 2021, 2022, and that's your baby, and you did all the stuff, and you're a great little brand manager, marketing person, whatever, making $100,000. Right? So then guess what? You get promoted or you move to another brand. So the new brand
Yes,
comes in and said, you know what? I don't like the Black people anymore. They're not cool anymore. So they changed the whole brand plan.
exactly.
That
Exactly.
is like the focus of marketing for corporate America. I worked at
That's right.
so many years where, you know, oh, do we have a multicultural marketing department, or do we put the money into the brand group? And it's always, no matter where it is, it's always a little bit of money just to like put the icing on the cake, or just to like make the party happen, just to sponsor the NAACP dinner. But
Right.
where are you in the long haul, right? Right?
Yep.
Right?
Yep.
Let's go to the Delicacy Convention and make a booth, right?
That's
What are we
right.
doing, right?
That's right.
So it's also, so it has to come from a high level in the company.
C-suite. You got it.
Gotta come from
Ricky.
the C-suite saying, we're doing this game for 5 years. And guess what?
Exactly.
We're gonna figure out the metrics along the way.
Exactly.
We're gonna
It's
figure,
got to come top down.
yeah, we're gonna see what happens and see how we're gonna make a difference here. But it's gotta be a corporate, high level commitment.
Commitment
over-
with a line item
Yes.
in terms of, let's put this in there and we'll figure out where it goes and how we focus it. Those are business decisions, but you got to be on the budget. You got to be on the paper
On the
in
paper.
order to make that happen. Because that brand manager is looking for the promotion and they leave.
And
You got
then-
to start all over again.
And you start over again with the junior person who knows nothing. I trained many of them. I got it, you know.
Yep.
In the meantime, Black women with breast cancer have a 71% higher risk of death. And I can't say that enough. And when I talk to pharmaceutical companies too, they're surprised by the fact that all these numbers add up to this huge picture.
Yes.
Here, the 40% number, mortality rate, the whatever, but no one looks at the totality of the numbers and the metrics.
Yes.
You want to know the metrics for the performance? Let's look at the metrics for the women that are dying.
Mm.
So what are we doing? What are we doing to help the women that are dying? While you're trying to figure out what your strategy is, are you trying to cure cancer? Are you trying to make it, you know, chronic? What are you trying to, like, what is your sort of overall objective? And what are you doing to help the women that are dying that call me every day?
You got to ask those questions. Put the screws to them. Put it on the table.
Well, for
And,
me,
and clearly they will listen, because from an evidence-based perspective, that's the foundation of quality care, that evidence-based medicine. If you don't have that, then what are you making these drugs for? I mean, we
Right.
know you want to make a buck. We get it. Don't do it at the expense of people's lives and the quality of their lives. You can do
And
both.
don't settle for just what's measurable,
There
right?
you go.
Ricky,
There
you
you
said
go.
something really important, because I think that is always the question that goes on the table first.
Yes.
Right? What is your overall goal with this
Yes.
campaign, with this trial, with this marketing, with this whatever?
Exactly.
See, I want to get you in here because you wanted to say something.
yeah, because again, for me, I approach it from a moral standpoint. I can't argue with you all day about percentages and this and that. This is a morality, an issue of morality, as far as I'm concerned. There's the C suite, and then there's the CSEE suite. My position is to make sure that you SEE this community, and that your response, you can corporatize that all you want, but you responding from your spirit, from your heart. Okay. If you in a position where you presented all this data, but you still can't see it, then okay, what's the problem? If you've been presented with all this data saying that X amount of people cannot afford this drug, can we get the Medicare formulary changed? And there's still no response or no change 5 years later. Okay, so it's not a data problem. Because how many times have we presented you with the data? Over and over and over again. So now I feel like this is where I step in and say, okay, you know what? This is different. This is a different conversation. And I can't shy away from it just because it isn't professional or it isn't widely accepted. My patients are human first. And I always tell people, what you got to understand from the patient's perspective is 9 times out of 10, excluding clinical trials, the clinical treatment is the easiest thing to get. How do you treat them as a human being? Now that we might have to deal with a little differently. So that's the area in which I focus on, because I don't believe they're separate. They're
not.
That's whole person care. So while I can't speak to a lot of the data, I can speak to the patient and let them know, you know what's measurable? When a child is not crying because they still have their mother, that's measurable. You know what's measurable? When they can get married one day, that's measurable.
Come on.
What are you talking about? We can't be afraid to present the moral imperative.
The humane
Because
medicine.
every time we exclude it, over time, we contribute to that diminishment. And then everything becomes clinical and nothing is compassionate.
Right.
And I want people in that seat, in those seats, to be compassionate as well as learned and all of that. Because if you know how to treat people, like really treat people, then you'll know how to care about people and care for them.
That's right.
So that's the lens that I try to bring, because so many poorer people aren't seen.
Right.
Okay, they're treated, but they're not cared for. And I want to make sure that they have the best of both.
This is deep.
And how would they treat their own family? How would they treat their own family? So when you see this brand person or this CEO sitting in the desk and their mother gets breast cancer or their wife gets breast cancer, do they act any differently? Do they look at it any differently? Like, you know, at the end of the day, you started with humanity in your first sentence. Here you are again. So it is like, and I tell patients all the time, like, ask them when a doctor asks you, you know, or gives you a treatment plan. So, well, is that the treatment plan you would give your mother or your daughter, your grandma, or your kid, or your auntie? That's what we need, that compassion at every level of this ladder, every part of this ecosystem. We need compassion and love, and that's the driver, not the dollars. And you know what? I always believe dollars follow the right thing.
Of course.
You know, like, no, I don't have any money, but I have what I need, right? You know what I mean? Like, if you do the right thing, you're going to be taken care of. And at the end of the day, God's in control.
Absolutely.
So, and you can't take it with you. So, like,
that's right. That's right.
You got to think about it in terms of, you know, we are people, and they're making people decisions.
That's right.
Lives at stake.
And it's actually good for business. Yeah. Because when your brand is truth, when your brand is dedication, when your brand is commitment, you'll never want for more people to really embrace and trust your brand.
That's right. Right. when I started my business and I was unsure about whether it's going to work or not. And when I left corporate America, my mom told me, baby, when you do the right thing, the money will come.
Mhm.
Yeah,
So,
my-
so,
yeah, same
and
thing.
so I never worried about it. You know, so as long as I'm alive, you'll have a roof over your head and food to eat.
Exactly.
So go with your heart, go with what you know is the right
That's
thing to do,
Yeah.
the ethical thing to do. And it's
Yeah.
always worked.
Yeah, because it's,
Got kicked off the Zoom and I came back, but here's what I got. I've been taking notes. Yeah, because it's kind of my jam, right? Because
Yeah.
what I heard you powerhouses say, I heard you say 5 key things that we can do now,
Mhm.
right? To start to change the way corporate America conceptualizes how trials should be done in communities and how outreach and how these campaigns should go. And 2, things that we can bring to them and bring to the forefront. Okay, so Kevin, let me recap real quick.
Okay.
And the first one I heard was get out of pilot mindset.
Hello.
Right? That
Hello.
as soon as you let that go and stop saying, well, we'll just test the waters and see, but actually make a commitment, put a ring on it, somebody said. Right?
Bingo.
Get out of pilot mindset. Number 2, make a covenant or an agreement for education and for resources in that community. So into
Yes.
that community, right? You got to put something in if you want to get something out, and that shows value. It shows the worth. It shows that you are seeing that community and that you're invested in the long term, right?
Invested, right. Mhm.
3, benchmark the success, put value on it. If you're going to utilize the community resources, put your money and put your resources behind it, right? Don't just come and suck the community dry and put us on a flag and put us on a pamphlet and put us on a t-shirt and not so into the community organizations that you are harvesting from and collecting all this
Exactly.
data and collecting all this money. That was 1, 2, 3, 4, continuity at the high level. So
Yes.
that you don't end up having new campaigns, new executives, reinventing the wheel, right? So
Mhm.
continuity at the high level so that the campaigns will continue beyond whoever the executive is or the person who's running that campaign. So when they
Right.
go, things don't die.
Exactly.
5, present and prioritize the moral imperative, right?
You hit it.
Tell
You
the
hit it,
story.
Dr. Mo.
See us, see these people as people and prove it and show it and highlight it first and foremost before anything else, the morality of it. I
Perfect.
got
Perfect.
5 things.
You got it.
You
There
got
it
You
is.
got it.
Put them in the
So for
net.
people who are watching, who are wondering what you can do in your community, in your hospital, in your neck of the woods, on your board, on your nonprofit, on
Right.
your, in your consulting work,
Mhm.
there it is.
It's right there. It's right there. And there are tactics to go with each of those strategies and each of those action items. Okay. We're talking about transformative action, not transactional.
Yeah, I
Okay.
love that. I love that.
Transformative.
I'm typing that too.
Exactly.
All right, so we got to write this article, you guys. All right, we're going to write this article and put in the Black newspaper.
Right on.
And I'm
And
Black.
if I may, just one thing, especially when you come from socioeconomically depressed areas,
Mhm.
I want to tell anyone out there who is viewing this, don't be afraid.
Mhm.
I'm not a college graduate. I have, first of all, God in my life, and
Mm.
of course, He's responsible for all of this.
Mhm.
But let me tell you something. When you know your truth, speak your truth. That's your
Mhm.
narrative.
And
You
it
don't
has
have to
power.
create a
That's
narrative.
right.
All you have to do is tell the truth.
That's right.
Correct.
And when I first started this journey, and I was representing my patients, I spoke 2 languages,
Mhm.
love and pain, because that's what my patients experience. And that's all I could carry was the love that they had for each other, for their families, the love I had for community, the love I had for God, and the pain that they were undergoing.
Mhm.
And God did it. And people respond to that.
They
Don't
do.
be fooled into thinking people don't respond to humanity. We just don't talk
Mhm.
about it enough.
That's right.
Mhm.
That's right.
So you go with that. Do not be deterred.
That's right.
Amen.
It's its
Amen.
own metric. It sure is.
Mhm.
Absolutely.
Wow.
Yes.
I like the title of this article to be transformational, not transactional.
Yeah, I
Bingo.
got it. We're doing
You
That's
it.
got
the
it.
title of the
I
article.
got it.
Emmy's
That
got
sounds good to me.
write this. Emmy's going
Yeah.
to write this. We got much to
And,
do.
Beautiful.
and what I tell clients too is that, before the middle of this century, 1 out of every 2 Americans will be a person of color or a person of color who speaks Spanish. So take the term minority out of your vocabulary.
Come on.
Okay.
Really
So
soon,
clearly,
corner.
who's the end user of that product? Who's
Mm.
really in need of that product? Start from there and work backwards and say, well, how do I get to those folks? How do I educate, connect with, empower those folks to motivate them to take charge and control of their health. Okay.
Wow.
So that's where you have to be. So take race out of it. If you're uncomfortable with that, we got that. Okay. We need the resources to do the right thing. So I'll
Right,
bring
do
them
the
into my
right
community, maybe.
Yeah.
Okay.
Yeah.
Go to school with your kindergartner, your first grade grandchild, and look at the classroom.
Okay.
That's the color of the world.
That's America. That's the new
That
America.
is America. That is the new America. Go to school. You know, they
Right.
are all in there. They are all colored,
Wow.
and they are ready to take on the world. And they
That's
don't.
right.
They don't see what we have grown up with. They're going to look
That's
at it
right.
totally differently. So it's
Mhm.
coming.
And it's never going back the way it was
It's
before.
never
This is
going
it.
back. This is
Okay.
it. The deal.
Mhm.
Woo! God,
Wow.
I'm like too fired up now. What are we gonna do? You
That
guys.
hour went by quick, didn't it?
It did.
Oh
It
my
really
God.
did.
How can people reach out to you? Because Sheila, all these companies that hire you, girl, and see, you gotta change the world. You gotta
Yeah.
change what's going
Well,
on.
you know, you eat this elephant one bite at a time. You know, so
Right.
my website is SheilaThorne.com, and there's a section on the website. If you want to have a conversation with me or a meeting with me, just fill it out, and I will connect with you to make sure that you're on the right track and bring people like Ricky and Z and providers like Mo to the table and say, I'm not alone. I'm in this, you know, for the long
Yep.
haul, and I got folks with me who know how to do this. Okay, so you just need to catch up.
That's right.
But watch her video on her website. You will be like blown away.
I love it.
Well,
And Z, I love you, Z, so much.
I love you
I love
too. I love all y'all. I'm just so blessed. I'm old, y'all, and I don't have a website yet, but I'm working on it. So in the meantime, you can email me directly at Jeanette@gmail. That's ZHONNET@gmail. And just put in blackdoctor.org and I'll know.
Excellent.
The doctor is in. I'm sorry. Put in the doctor is in. And
Okay. Okay.
I'll know where this email is generated from.
Yeah,
Wow.
we're gonna give you a little presence on our new website we're building. So don't worry.
Great.
Well, all right now.
Here it is. Wow. I think that we
Y'all
should
gonna make me
meet
cry
back.
right at the end. I was trying to look like post-pandemic.
Honey, you're glowing. You're glowing.
Yes, absolutely.
Girl.
Yes. Truth to
Mhm.
power.
I
Yes.
love you guys so much. Woo.
I think we should check back in. I think we should check in
I
toward the end of the year so that
Okay.
we can give a grade on the progress of 2021 and set the agenda for 2022 moving forward. What sorts of things should we be looking for and talking about for accountability? How did we do this year? The year post-COVID, when everything seemed to matter so much, did we really get the job done? So I think that we should reconvene before the end of the year.
It's a must.
And let's talk about this again.
Yeah,
I'd love to set
December 8th. I'm putting it on.
December 8th. Okay.
There it is.
We'll work on our metrics for 2021. Hello.
Hello.
There it
Hello.
is.
And for 2022.
Well, girl,
Wow.
you got me all like, hey, my head gonna be this big by the time the thing over talking about a presence on your website. I'm like, girl, don't play.
Be careful what you pray for, right?
We're going to be at SABCS December 8th, Mo.
Yeah. Yes, we will.
Doing our show
Love it.
live from SABCS. And so
Right
you're
on.
all
Fantastic.
on.
Love it. Love it. Well,
Awesome.
you know, the message is to anybody out there that wants to be an advocate, wherever you are in the continuum of advocacy, lead,
Right.
follow, or get out of our way,
Yeah.
because we're going to make the
Yeah.
change happen. And it's got to happen now, because this
Right.
window of opportunity may not stay open long.
Right.
So we've got to insert ourselves. Don't ask for the invitation. Just make sure you're supposed to be at the table.
That's
Okay.
Right. Bring your plate, bring your knife and fork, your glass.
Yes, that's right. Easy to ask forgiveness and
Transformational.
permission, right?
Not transactional. I
Right.
love it.
Take them nice
Thank all you ladies because you help usher in the transformation and sustain it and contribute so mightily to it. You know,
Mhm.
not many places that provide a space, not designate, okay? I said
Mhm.
provide
Mhm.
a space for these type of conversations to have as
Wow.
Black women, as women that may be from a lower income or are
Mhm.
not academics, and it's so greatly needed and appreciated. I hope you understand the void that you ladies are filling and the opportunities that you are sincerely providing. I could cry. I'm so happy. So thank
No,
you.
no question. You know, you got to
Thank you for
stop
that.
talking about it and be about
Be
it. And
about
that's
it.
what you two
Stop
ladies have done.
talking, be about it.
Wow. Thank you
Gotta
for
be
that.
about
You
it.
know,
Yes.
it ties into our mission. We've been doing this for over a year now, every single
Wow.
Wednesday, and we set out to do something that would be relatable, it would be
Mhm.
reliable and real.
Mm-hmm.
every single Wednesday night at 6 o'clock here on blackdoctor.org. So,
Love it.
thank you for joining us. Thanks to our sponsors. Thank you for being here. Thank you for listening, for sharing this on your social media outlets, for asking
Yes.
questions, for getting involved and doing your part, for sharing your narrative, all of it. We're so, so grateful.
So blessed.
I'm
Dr.
grateful for you as well. Yes, indeed. You know,
Look
it's
forward to
about
talking to
humanity.
all of you.
It's about living a long time and living a quality life. We're all entitled to that.
Yes.
And if you're really serious about health equity, you got to
Yeah.
join us. Okay.
Absolutely.
The train has left the station, so you need to catch up.
Absolutely.
It's moving fast.
Wow.
Okay.
Well, join us again every Wednesday night. The doctor is in.
Thank you. God bless.
Next week,
God
we're going to
bless.
have our interns on. We're going to have
All right.
like our badass HBCU interns. You got to tune in. They are like
Breasty
phenomenal.
love.
Okay.
And we put a survey in the chat. You can make, if you're a breastie and you want to make $200, help
Okay.
us eradicate Black breast cancer. It's in the comments.
Love it. Love it. Love it. Well,
There it is.
All right.
be
care.
well and stay safe.
Love you,
You
girls.
too.
Look forward to talking to you soon.
Bye-bye.
You got it. There's a breasty love. I love it.
Bye.